My name is Amanda Sargent. I am an assistant professor here at University of Bridgeport, Fones Dental Hygiene School. I am a clinical and didactic professor. Most of the equipment was supplied for us or purchased through grant funding through the Bridgeport Rescue Plan Grant. We were able to purchase a majority of the teledentistry equipment, the intraoral cameras, and the Nomad at that time, and then we've added other equipment with other grant funds. The intraoral scanner was one of our newest additions, and that was brought to us because in dentistry, we've kind of phased out of doing traditional impressions. So these days, it's all done through an intraoral scanner. It runs in 3D. It's able to visually impression all of the areas inside of the mouth. It is also able to give you the depth, height, width of things as well, and it recreates a 3D image that the laboratories can use to make any number of things, from prosthesis to impression trays. Any customizable 3D printable device can be done through the intraoral scanner. The intraoral camera has allowed us to record patients in various stages of treatment. It also allows us to transmit information via the photographs themselves, whether it's a lesion that we're concerned about or a baseline information for the patients themselves. It also allows us to communicate and facilitate our teledentistry rotation because the camera is how we are visually able to introduce the patient's clinical information to the doctor here on campus. The laser is a treatment device. We utilize it for many different reasons. We can eliminate or arrest certain lesions at different phases. It can desensitize patients in a number of fashions. Cold, hot sensitivity is something that patients suffer from quite a bit, so it can desensitize the patient. It can also do pocket reduction. Pocket is inflammation, and we can reduce the amount of inflammation based on the amount of bacteria that we can eliminate with the laser within the pocket. We can also do that procedure throughout the mouth, and that too will eliminate the amount of bacteria, allowing the patient to heal a little bit better. It's taken the chemical aspect out of medicaments and treating patients. It can kind of seem more of a holistic approach. We are the only and the first program in the country to include teledentistry and this equipment in our education curriculum. After COVID, there was, I don't know if it was just a fear of the dental office in general, or if it was patients, and their fear to venture outside and go back to real life and the way things were. So we purchased the equipment to get out into the community and to treat the patients where they were at, as opposed to making them come to us. We've been to school settings, we've been to outreach programs, so it just allows us to get out into the community again and bring the equipment to them, and no barriers that way. The Nomad is a handheld X-ray device. It allows us to take intraoral images on our patients, X-ray images on our patients with a dramatically less radiation. It is safe for both the patients as well as the clinician. We no longer have to be in the traditional dental chair setting with the arms and all the equipment that comes with it. The Nomad allows us to take our equipment and go on the road and treat patients anywhere. It also allows us to facilitate the teledentistry rotation, which allows us to treat patients off-site because we have this equipment that is found in every office that's out there. So it makes them more comfortable with utilizing when they get out there.